Are Ozempic, Mounjaro, Wegovy, and similar drugs good for your heart health? If you've been following recent medical news, you've likely noticed increasing attention surrounding drugs like Ozempic, Wegovy, Mounjaro, and Rybelsus. Originally developed for managing type 2 diabetes and obesity, these medications are now being evaluated for broader health benefits, including their potential role in promoting heart health. Ozempic, approved by the FDA in 2017 for type 2 diabetes, and Wegovy, approved in 2022 for chronic weight management in certain obese individuals, both contain the active ingredient semaglutide. These drugs, alongside others like Mounjaro, tirzepatide, and Rybelsus oral semaglutide, belong to a class known as GLP-1 receptor agonists. Their effectiveness has led to an unprecedented surge in demand, resulting in production and supply challenges. But how do these drugs relate to cardiovascular health? Let's focus on Ozempic and Wegovy, the two semaglutide-based medications that have dominated headlines. Ozempic is primarily used to help lower blood sugar levels in individuals with type 2 diabetes by improving insulin sensitivity. However, one of its most noticeable side effects has become one of its biggest advantages: weight loss. Many patients using Ozempic experienced reduced appetite and significant weight reduction. This led to the development of Wegovy, a higher-dose formulation specifically approved for long-term weight management. Weight loss and improved glycemic control are two major factors that contribute positively to heart health. Obesity, insulin resistance, and type 2 diabetes are closely linked with cardiovascular disease. By targeting these conditions, semaglutide-based drugs may indirectly reduce the risk of heart-related complications. Moreover, emerging clinical evidence suggests a direct cardioprotective benefit from GLP-1 receptor agonists. Several studies have indicated a reduced risk of major adverse cardiovascular events, MACE, in patients using these medications, particularly in those with existing cardiovascular disease or risk factors. These findings support the idea that these drugs may be good not only for diabetes and weight loss, but also for improving heart health outcomes. It's important to note that while Ozempic and Mounjaro are primarily indicated for diabetes, healthcare providers may prescribe them off-label for other uses, including weight loss or cardiovascular risk reduction, depending on individual health profiles. In summary, while these medications were originally developed for diabetes or obesity, growing clinical data suggests that drugs like Ozempic, Wegovy, Mounjaro, and Rybelsus may also offer significant benefits for heart health. However, patients should always consult with their healthcare provider to evaluate the potential risks and benefits in the context of their unique medical history. Stay informed, stay proactive, and always seek professional guidance before starting any new treatment. A surge in popularity fueled by social media has led to an increasing number of individuals, many of whom do not meet medical criteria, receiving off-label prescriptions for these medications. This trend has significantly contributed to the nationwide shortage of drugs like Ozempic, Wegovy, and Mounjaro. While public interest is understandable, this shortage raises concerns, particularly for patients with type 2 diabetes or obesity who depend on these therapies as part of their medical treatment plan. This brings us to a critical question. Do these drugs really work, and are they good for your heart health? The short answer is yes. When used appropriately and under the right clinical circumstances, these medications can be very effective. Metabolic disorders such as high blood pressure, type 2 diabetes, and insulin resistance are well-established risk factors for cardiovascular disease. GLP-1 receptor agonists, like semaglutide in Ozempic and Wegovy, and tirzepatide in Mounjaro, address multiple aspects of these conditions. These drugs work on both the gut and the brain to enhance satiety, reduce appetite, and regulate glucose metabolism. This often leads to significant weight loss, improved glycemic control, and reduced inflammation, all of which contribute positively to heart health. However, rapid or unmonitored weight loss is not without risks. One concern is the loss of lean muscle mass, particularly when caloric intake becomes too restricted or protein intake and physical activity are insufficient. While overall weight may decline, Not all fat lost is beneficial. Patients may lose muscle instead of visceral fat, leading to a phenomenon sometimes referred to as skinny fat. This can result in long-term consequences such as osteopenia or osteoporosis, particularly in individuals who fail to maintain adequate nutrient intake or weight-bearing exercise routines. Additionally, sustainable lifestyle change remains a crucial part of any heart-healthy or weight management plan. These medications are not intended as permanent solutions in isolation. If patients rely solely on pharmacotherapy without incorporating dietary improvements, regular physical activity, and behavioral changes, any progress made may be temporary. Once the medication is discontinued, patients who haven't adopted long-term habits often regain the weight, potentially exacerbating their cardiovascular risk. In short, drugs like Ozempic, Wegovy, and Mounjaro can play an important role in improving heart health, but only when prescribed appropriately, monitored closely, and combined with permanent lifestyle changes. For individuals with metabolic disease and elevated cardiovascular risk, these treatments offer a valuable tool. But for the general population, using them without medical oversight can undermine both personal and public health outcomes. Always consult your healthcare provider to determine whether these therapies align with your individual health needs and goals. What's the bottom line? If you have type 2 diabetes or are struggling with obesity, and you meet the medical criteria for prescription medications like Ozempic, Wegovy, or Mounjaro, it's worth having a conversation with your healthcare provider. Whether you speak to your primary care physician, a cardiologist, or an endocrinologist, the goal is the same: to determine whether medical weight loss through prescription therapy is the most appropriate path forward for your health. These medications, while not without side effects, are generally considered safe and effective when used as prescribed. More importantly, they may reduce the more serious, long-term risks associated with metabolic diseases and cardiovascular conditions. Your medical team will help you weigh the risks and benefits, considering your personal health history and risk factors for future or existing heart disease. Maintaining muscle mass during weight loss is also essential, not only to avoid skeletal issues like joint degeneration or osteoporosis, but also to preserve your body's natural calorie-burning capacity. This is why nutrition and exercise play such a vital role in any treatment plan involving GLP-1 agonists. Patients who pair these medications with resistance training and proper nutrition are more likely to sustain their weight loss long-term, even after discontinuing medication. It's also important to acknowledge what we don't yet know. More research is needed to understand the long-term safety, effectiveness, and sustainability of these drugs. While the early data is promising, these treatments should be approached as one part of a comprehensive cardiovascular and metabolic health strategy. Although choosing to begin medication may seem straightforward, every therapy, no matter how innovative, comes with risks. That's why having an honest, informed conversation with your physician is critical. These drugs may be a significant breakthrough in the management of weight and diabetes, but they must be tailored to your unique medical needs. Want more science-backed health information? Subscribe to HeInfo, your all-in-one destination for trusted, accurate, and evidence-based health education. Leave your questions in the comments. Like this video if you found it helpful, and share it with someone who may benefit. And, as always, stay informed, stay healthy, and take control of your wellness journey.